marginalized groups. So here we go, legal aid's pivotal role in patient advocacy. Here's an overview of what I'm gonna talk about. I'm gonna start by paying tribute, if you will, to the roots of healthcare legal aid to better understand the values of what we do and our goals. And then I'll give you a snapshot of the players in the healthcare legal aid field, so you know who's out there doing the work and how we all work together, followed by an overview of the kinds of legal advocacy that make such a big impact. And then we're going to highlight some specific areas, which maybe is the part that will spark the most interest, some specific areas where healthcare legal aid has made a real difference for people removing barriers to healthcare. And then we're going to wrap up before we do the Q&A with just thinking about a little bit about what might be coming down the pike pretty soon in healthcare legal aid. So I thought it was important and kind of exciting, at least to me as a person in the field, to begin by talking about the roots of healthcare legal aid, because it really explains a lot about what inspires this area of health advocacy, its goals and its values. And I want to specify, when I'm referring to healthcare legal aid, I'll use that as a phrase. What I'm talking about in this context is free legal assistance, no charge for the clients. That's helping clients, usually income eligible clients, most often, with access to healthcare problems. So in talking about the roots of healthcare legal aid, I want to use my organization, if you allow me to, as a proxy for the healthcare legal aid field, because we're unique in that the vast majority of what we do as an organization is provide legal services. And you'll hear a little bit later about what other related organizations do. Plus, all of our cases relate to healthcare access. And there are two different views in my mind, in my experience, that have intertwined, that have combined over many years, decades, and even longer to make healthcare legal aid a powerful force. So first of all, on the top, there's the consumer healthcare advocacy movement. And then on the bottom, the legal aid movement. The consumer healthcare advocacy movement is all about the belief that for healthcare to work for patients, we as patients and consumers, as we talk about ourselves in our field, we have to have a meaningful voice, a seat at the table in setting the policies that determine how our healthcare system operates. And that's especially true for people who are members of marginalized groups and lack power in society generally. So a real watershed moment in the consumer healthcare advocacy movement was a particular moment in time was the founding of the Villers Foundation in 1982 by Kate and Phil Villers. And they endowed the Villers Foundation in 1982 with $40 million contribution, which equates to about $130 million today. And they set out with a mission to improve healthcare access. That was their entire mission for all Americans, by organizing and empowering consumers so their voices were heard and impacted policy debates. The Villers Foundation was located in Washington, D.C., later changed its name to Families USA, and remains one of, if not the central organization helping consumers determine healthcare policy nationally. The Villers Foundation also set up one satellite office, and luckily for us, that was located in Boston. And what it did, it was piloting the movement of amplifying consumers' voices in healthcare policy debates at the state level, where we all know so much healthcare policy is made. That satellite office of the Villers Foundation evolved in 1985 into the organization called Healthcare for All. And Healthcare for All, as many of you know, remains the leading consumer-focused healthcare policy organization in Massachusetts. And it's been replicated in many different states and in different forms across the whole country over the past now 40 years. Of course, there have been other grassroots movements that have pushed for healthcare rights. for consumers over many, many years, the labor movement, the civil rights movement. But I'm highlighting this area and this strand in time because this is purely about consumers impacting policy to improve healthcare access. So as Healthcare for All and Families USA and other organizations are organizing consumers to demand public policies to expand access, there's the question of, so what happens when the political system doesn't respond? You organize, you go to the State House, you go to Capitol Hill, and there's no movement. And that obviously can happen because there's a lot of powerful forces out there. So what happens when it doesn't deliver what consumers want? Or what happens if consumers win and they get a good law passed? What happens if nobody follows the law? They're not enforced. And that can happen too, as people know. So, and that, in my mind, is often where healthcare legal aid plays the essential role. So now let's look over at the legal aid movement that intertwined with the healthcare advocacy movement, like I said, for consumers. So the concept of a legal aid system in the US goes back to the creation of the legal aid societies in the decades before the turn of the century. And they were charitable groups, often run by volunteer attorneys, established initially to protect the rights of poor immigrants and gradually expanded to protect the legal rights of all financially impoverished residents to help them meet basic needs. But they were very thinly staffed, not that we're robust now, but they were really shoestring operations, but really started the movement. In the early 1960s, legal action by the ACLU and NAACP to protect civil rights inspired the Ford Foundation to pour major financial resources into local legal aid organizations and around the country to solidify the infrastructure of legal aid. In 1965, the federal government takes the baton from the Ford Foundation as in the war on poverty, LBJ's war on poverty, and the creation of the Office of Economic Opportunity, which funded and expanded legal aid offices all across the country. And in addition to funding organizations that were assisting individuals with their concerns, they also established national legal support centers, which is an important part of our network, as you'll see in a subsequent slide. And these were based in universities, including and one of them was the National Health Law Program. And the OEO also made a point of saying, all of these organizations out here, you're not only going to focus on serving individuals, but you're going to strive to achieve reform in the law as a goal of legal aid. The OEO eventually got defunded in the Nixon years. It was replaced the funding for legal services because there was significant bipartisan support for legal aid that was transferred to the new Legal Services Corporation. Subsequently, there have been some opposition to funding for legal aid and the use of legal aid funding, which led to, in Massachusetts, the creation of the Massachusetts Legal Assistance Corporation in 1983, which is now the largest funder of civil legal aid in Massachusetts. So by the 1990s, there's legal aid organizations and legal support centers collaborating with the consumer healthcare policy advocacy movement, but there were still a number of healthcare barriers that were not being addressed by legal aid and health policy advocates. And that was the impetus for the creation of the organization where I work, Health Law Advocates in Massachusetts. And what we were meant to do was to fight for healthcare access in areas where policy change wasn't the right solution at the time, or even possible, and that the legal aid movement and that the other parts of the legal aid movement weren't addressing. One really prime example is providing representation for people who can't access healthcare because they're having trouble with a commercial health plan. So legal aid organizations are doing great work helping people who are on Medicaid, but most people in Massachusetts have private insurance, and a lot of those people have low income. So that was one big area that our organization filled a gap in the whole constellation of legal aid. Another gap we filled was providing representation for people who make just too much income to be eligible for legal aid, which the eligibility levels are very, very low, just above the poverty level. And so there were people who were facing access barriers, not eligible for legal aid, facing healthcare barriers, but no way that they can afford a lawyer to help them address their issues. So that was another area health law advocates stepped in to help with. So we came along 30 years ago, and our field of healthcare legal aid is still, of course, evolving and has evolved over the past 30 years and will continue to evolve, with new organizations being created similar to HLA and new areas of practice being developed to address unmet needs, just like HLA was meant to do. So moving on to the conversation about the constellation of organizations that provide healthcare legal aid to folks who need our help to access care. So each of the kinds of the organizations here fills a really unique and I think important role in the constellation of healthcare legal aid providers. And I put us at the center because, as I said, healthcare legal aid, the topic of this discussion, is really all we do. Purely, that's all we do. And that's not so much the case for the other organizations. So on the far side, you have general legal aid organizations that, and they're the heirs to the legal aid societies. And they, for the most part, the vast majority of what they do is provide legal aid for individual residents who are having trouble accessing basic needs in their lives. So things like housing, immigration law help, and other issues. And they also typically will have a division within a larger organization that works on public benefits, including Medicaid. And that overlaps with an important part of our work. We also, on this side, have issue-based legal aid organizations developed mostly in the 1970s, 80s, and 90s, and they're the local heirs to the legal support centers created by the OEO that I talked about to, for the most part, seek healthcare reform and reform in other areas of the law. You have their counterparts on the national level, like the National Health Law Program that I mentioned, the National Consumer Law Center, and these are organizations that provide technical assistance, they call it, support for local legal aid organizations who are trying to build cases, maybe large cases or even small cases, and they provide really a reservoir of information and guidance to local legal aid organizations around the country. And they also play an important role in large class action lawsuits. The private bar, I wanted to give a shout out to the private bar for sure, because they play such an important role both in representing individual clients and also in taking on class action cases, and I'll get to a couple of those in a few minutes. And then then there's the really important alignment that I talked about in the previous slide with healthcare policy. And how that plays out is that these organizations like Healthcare for All and other organizations that focus on policy for the most part, they have a lot of success with their policy advocacy, but when they identify healthcare access barriers that the political system just isn't responding to, they'll often look to legal aid to move the needle. Similarly, it also goes the other way, where organizations like ours, we're representing hundreds and hundreds of people who may face similar problems, and a legal case just it's not feasible, it's not the right moment, it's not possible to bring it, and we'll often work with policy advocates to take on an effort to solve a problem through the political system. So that's who's out there doing this work, and where we fit in and overlap with other folks. So how are we doing? So there's a lot of words and stats on this slide, but we have to talk about what's going on. I said at the outset that there's a lot of great things about our healthcare system, and there's a lot of things that really aren't working very well. And this slide is meant to review some of those and give a hint to some of the issues that we work on. So there's data from this Massachusetts Center, the Center for Health Information and Analysis, CHIA, and most recent survey said 41.2% of Massachusetts residents report a barrier to healthcare. Not very encouraging. It's higher, obviously, as you can see, among folks with on the lowest income scale, and for people in the poorest health, even higher. In terms of affordability and medical debt. So these are debts that it's not just you folks can't afford them and they're paying off over time. These are debts that are absolutely not affordable, that are just sitting on people's accounts and oftentimes are subject to collection activities and other and even lawsuits in some cases. So 1 out of 8 Massachusetts residents has medical debt, even though we have 97% rates of coverage. Across the country, it's much, much higher because of the difference in rates of insurance coverage, obviously. As George mentioned earlier, mental health care access for youth. One study by Mental Health America shows nearly half of kids nationwide and even in Massachusetts with major depression don't receive any treatment. And then access to healthcare for immigrants, also another area where even though we provide pretty generous coverage for immigrants in Massachusetts, subsidized coverage, the uninsurance rates for immigrants is 4 times that of US citizens living in Massachusetts. And that includes immigrants who are just on emergency Medicaid are counted as insured there. So they have very, very poor benefits. And then there's other issues that I know folks are really familiar with. Gender affirming healthcare for transgender people. There's certainly many racial and ethnic barriers in healthcare that are deservedly getting more and more attention. Reproductive healthcare, it's not a particular area of practice for health law advocates because there's some other really important groups that lead the way in that area, but I wanted to mention it. And then of course, Medicaid is an area where obviously a fantastic program, but it's in the crosshairs, so to speak, of the Congress now, and there could be problems coming down the road. Hopefully not. So the next slide, sorry. As I said at the top, there's all these issues out there and that need to be addressed. But when is legal aid the right tool to use, the best tool? So here are some things to think about, how it, the big picture of what a case might look like when you're looking to handle a case either on for an individual or a larger case. So in some situations, the political process, like I said, has worked. So for example, the Affordable Care Act passed. The consumers had a big amount of credit for that, but some of the rights in that law, maybe even more than some, they're not truly real life for people. They're not being enforced by the government or private practice. So that's one way to look at healthcare legal aid, enforcing the rights that we've achieved in the law. In other situations, and some of the examples we'll get to this, the political process has failed, and it has either done nothing or even produced bad laws, worst case scenario, that impose healthcare barriers. And we'll get to one of those examples in a little bit, and those have to be challenged. And then I also mentioned we're constantly looking for ways to play off of policy advocacy and look at ways where one strand of advocacy can maybe put pressure on or provide support to the other. And who are we trying to help? Well, thousands and thousands of cases are brought for individuals in Massachusetts who are having healthcare difficulties, and obviously more across the country, but also really important class actions and other impact type lawsuits are being brought for entire populations. And we always consider both types of cases when we're doing our work. So that's the big picture. And now I want to get to some examples, real life examples of how legal aid has really made a big difference in healthcare access for patients or consumers. So I think a great example in a couple of different ways is work that's been done by our organization and others to protect immigrants' rights to access to healthcare. So the last time we had major budget crisis in Massachusetts. Folks, I think we'll remember it was the Great Recession, 2008, 2009, and billions needed to be cut from the budget as a result of that economic downturn. And what happened was that after Massachusetts healthcare reform law was passed in 2006, during that period of time, that law expanded coverage, publicly subsidized coverage, to all low-income residents, regardless of immigration status, except undocumented immigrants were left out, unfortunately. And for most residents who relied on this subsidized coverage, the federal government shared the cost. But for thousands of immigrants, the state had to pay the whole cost because of federal law. So as a result, when they were looking for cuts to achieve the most savings, the state decided to cut benefits for tens of thousands of immigrant residents. Policy advocates went out there and tried to reverse those cuts, but the governor signed that into law, and the law stood, and benefits were reduced for tens of thousands of immigrant residents, legal folks that were here legally and under different statuses. So seeing that policy advocacy had failed, we filed a lawsuit challenging those cuts, saying that they violated our state constitution. The case was heard in the Supreme Judicial Court, and they held that the cuts were unconstitutional because they discriminated on the basis of national origin as prohibited by our state constitution. So as a result, the state was forced to restore full benefits. They had no choice. The political process wasn't at issue anymore. Our court had ordered them, and that meant something, to restore full benefits to about 30,000 Massachusetts residents. That was very, very important and established an important precedent. But for years, we've also been expanding access for immigrants by enforcing the law as opposed to challenging the law. So every year, we represent hundreds, 300 and more immigrants per year who are eligible for comprehensive benefits under Mass Health, but they've been assigned to plans with limited benefits. Sometimes they only have coverage for emergency care, but they're eligible for comprehensive coverage. And there are all sorts of reasons why this happened. The eligibility rules are complicated. The application process is hard to navigate. But as a result, immigrants go without care because they don't have the benefits. And it's actually not uncommon for immigrant patients to even get stuck in hospital beds because they don't have coverage for community-based care, and they therefore can't be safely discharged from hospital inpatient beds. That ends up, of course, being really very terrible for patients' health, and it also ends up being really expensive for the hospitals as well. And so until we get a hold of these cases, and our team does a great job getting folks into higher levels of coverage that they're simply eligible for, but have been denied, and they then have benefits for community-based care, and they can be safely discharged legally by the hospital. So to prove how effective that work is, we conducted a study with the pro bono help of a big consulting firm, which stepped forward to help us pro bono, called Analysis Group. And they analyzed the work that we did right around the corner here with Boston Medical Center's Immigrant and Refugee Health Center. And what they found is that the hospital was incurring about $250,000 in annual costs for a group of about 9 immigrant patients over a 5-year period, $250,000 annually over a 5-year period, because they didn't have coverage for services and that would allow them to be discharged safely. So those hospital costs were eliminated once we were able to represent these patients and get them the benefits that allowed them to be discharged. And then lastly, through all these cases, we also identify other inequities, and where a lawsuit or legal action might not be the best course of action for a group of immigrants experiencing the same situation, we'll advocate with policymakers as opposed to a judge to change the law. So the second of 2 areas that I wanted to talk about where there's been important, really important work by legal advocates is protecting access to healthcare on behalf of people who are transgender and suffering from gender dysphoria. So we start off here, obviously, with the fact that extensive medical research over decades has concluded that gender dysphoria is a serious medical condition for transgender adults as well as adolescents, and that certain treatments are medically necessary. In January, the Trump administration issued an executive order directing federal agencies to take all federal funding away, so presumably Medicaid, Medicare, all research funding from any entities that were providing treatment for gender dysphoria for patients under age 19. So it caused panic among families when some hospitals across the country immediately paused or ceased providing gender dysphoria treatment for adolescents. And there was really obviously no realistic avenue to immediately challenge the policy through the political system. So the ACLU and Lambda Legal and two big law firms, Jenner and Block and Hogan Lovells, they sued in federal court in Maryland and to stop the implementation of the order. And they under claims that it violated the US Constitution, and also claims that it contradicted other federal non-discrimination laws that needed to be enforced. So they're playing both sides of the strategies that I mentioned earlier. They got a preliminary injunction, and the case that enabled services to be continued to be provided, and the case is ongoing in federal court. But the regulatory changes suggested in the executive order are now on hold by court order. So again, that's a great example of using legal aid to protect healthcare access for an entire marginalized population. And now the third area, third and final specific area I wanted to talk about is children's mental health care. And as we saw before, we saw the statistics showing that really tragically, there's just so many children out there who aren't able to access really needed treatment for mental illness. But legal aid has made a really, really enormous difference in this area of the healthcare system as well. In 2001, two statewide issue-based legal aid agencies that I talked about during the Constellation slide, the Center for Public Representation, which helps folks with disabilities, the Mental Health Legal Advisors, along with a big law firm then known as Hale and Dorr. They sued the state on behalf of tens of thousands of children on Medicaid with mental illness who were not receiving intensive home-based services as required by federal Medicaid law. And this was called the Rosie D case, which may be familiar to a lot of people. Rosie D was a 13-year-old girl with intensive medical needs who was not receiving the care that she needed. So after years-long trial, a federal judge ruled in the plaintiff's favor, and they ordered the state to really restructure its mental health system for kids pretty much entirely. And it made just a huge difference for kids and allowed them to live much healthier lives as a result. The court in that case actually kept oversight over the case for 20 years after the case was filed. So you can see the long-term impact a case can have. It's not just a court order and then, good luck to the system to implement it. In this case, the court made sure that the state was complying with the law over 15 years or so after the case was decided, and it made an enormous difference. But obviously that didn't solve the whole problem for children's mental health. And HLA has made a big investment in that area of healthcare access as well. Our largest program is our mental health advocacy program for kids, which provides individual representation for more than 800 kids and their families per year. They're unable to access mental health care, and these are 800 intensive cases. They're not just like you make a call and solve the problem. They're intensive cases that last on average 6 months or so. And it's had a huge impact. And we actually have the Boston University School of Public Health to thank for the data analysis that proves that. So for 10 years, I'm not sure if folks know this now, I'm excited to let you know if you didn't know this, but for 10 years, a research team here at the School of Public Health led by Dr. Patricia Elliott, here at the School of Public Health, they've studied our program and found that children who receive services from our program have measurably, significantly improved mental health. The same is true for their parents. of the kids who receive our services, their family functioning significantly improves. The family's ability to earn income improves. That's a new finding of the study. Kids are much less likely to be hospitalized as well, and also less likely to be in the emergency room. So those are three, I think, really prime examples where legal aid has made the essential difference for patients and consumers in the healthcare system. Sometimes healthcare legal aid isn't the right solution to improve healthcare access. Sometimes it's the only solution. And I hope after hearing this, you're a new believer or an even stronger believer in the essential role of legal aid in healthcare. And just a few comments to talk about what's to come, because folks may be thinking, well, that's great, but what's happening in the future? There's obviously a lot of issues in the healthcare system, to say the least. And I think George mentioned we have a new focus area on medical debt, which is a really important issue for us. There's a lot of legal protections out there in the Affordable Care Act and elsewhere in the law that are supposed to help people from medical debt. The policy advocates have done a great job, but a lot of those laws aren't really very well enforced. If there are huge cuts to Medicaid, we'll see what happens. If legal action will have an important role, especially for folks with disabilities. There's a lot of law out there that's supposed to protect people with disabilities. What if healthcare coverage is taken away? And other areas, immigrants and transgender people are obviously big targets right now. And I think legal aid is going to have a really important role, along with all sorts of other types of advocacy, to help those groups maintain access to care. So I know we'll be busy, and hope you'll follow along and the work that we're doing. And I'll be following along with everything that you're doing as well. So thank you very much.
Matt, thank you. Thank you. Huh? Oh, Matt, thank you very much. That was terrific. As a law student who spent time working in legal aid, my second and third year, brings back old memories. But legal aid has been around a long time, but it's obviously much more sophisticated than it was in my day as a student. And I guess that was uplifting.
It was meant to be.
I mean, I guess you pick your shots, and if you win, you do good. But there are obviously a lot of people out there who need care. I don't have to tell you that. But rather than me monopolizing this, let me throw it open. We have online audience questions, and in a little while we'll take personal questions here for people who are with us. Let me just ask you these questions. How can students or early career attorneys get involved in patient advocacy?
Great question, and such a helpful question. And I think that it's indicative of the fact that I think that there's a big sense of people wanting to help students and folks looking to continue their education. We were talking earlier that I've seen articles saying that applications to law school are at their top level ever. And so there's a lot of ways that students are early career lawyers, a lot of ways that folks can help. Of course, there's the tried and true internship with a legal aid organization, an organization like ours that does all legal aid. But look around, there's tons of organizations out there that are so easy to find online through maybe some of the foundations that support legal aid organizations. You can see who all their grantees are, and there's larger social service organizations who have lawyers working there. So there's all sorts of places where undergrads, probably more likely law students, can go in and spend a summer or a semester volunteering and really helping, clients getting, on the phone with people, doing intake interviews, and learning a ton, just the immersion of being in that setting. The amount that you can learn in a short period of time is pretty significant. And also, even probably easier for younger lawyers. Our organization has a pro bono legal network, and we love it when we get an email from somebody and they say, I want to be in your legal network and I want to volunteer to take a case. I was just looking at our brand new database that we got for our organization to see just in half of our organization, we have more than 50 cases that have gone through intake already and need a lawyer, and one of our lawyers doesn't have capacity to help. So we would love those cases to go out to a volunteer lawyer, and organizations like ours and other peer organizations get it that we're not just going to hand off the case and say, oh, you just run with it, you know how to handle it. There's obviously a sense that folks need mentoring and support and so forth. So volunteers are really welcome and needed, I think, in our field, and it's a great way to learn and then take back into into school or the law firm where you work and kind of preach the gospel and like tell your coworkers that this is important and these are ways you can support the movement too.
Good. I got a question before all this started about how you retain staff. Is there a burnout problem with volunteer lawyers?
So burnout is very real in our field. The work is really challenging. The people, in a lot of fields, maybe, in some parts of healthcare too, your whole day is hearing about problems that people are having. And that is obviously, not an easy way to go about like your day. And they're really difficult problems. They're problems that are impacting their life in a really terrible way. And so, that in itself, can be very stressful. So we try to do our best to keep, morale up, and we love it when folks, stay for a long time with our organization, for years and years. For a lot of people, that works for them. And for other people, it's a shorter period of time and you move on to something else, and that's fine. Whatever people can give to the profession is fantastic. We, again, try to be cognizant. And really, I think the whole legal aid field is becoming more and more interested in wellness among attorneys. And there's support groups among the licensing agency in Massachusetts that's trying to help people cope with the stresses of being a lawyer. So, but it's really rewarding too. Like every day you go and, you're not, your salary probably isn't, as high as, somebody who's working at a corporate law firm, of course. And that's real, but you do come away from the work and go to work every day feeling like I'm in the game, I'm in the action, and I'm making a difference, and my work means something. And that is, I think, and that's the countervailing force behind, against the burnout, is the reward of it and the feeling that you're on the right side of a lot of things and you're helping people. And that's why people are in it, because they're helpers. They're people who want to help.
Well, we know they're not in it to make 10 to 20 million dollars a year.
Usually not.
Didn't even know you could make that
Yeah.
much as a lawyer.
Yeah.
Obviously doing something else. Just be a lawyer. Yeah, I want to take a question from the audience, if that's okay. Go ahead, Heidi.
Thanks, Matt. Great presentation and really helpful. We are incredibly lucky to be in Massachusetts and have an organization like yours. But I know that we have a national audience online, and I'm wondering for the advocates who are online listening, if they are in other states, where do you recommend looking, or what do you Google to find out what is available in their state in terms of legal aid?
Sure.
They go to Families USA and try to find, is there a central organization you all belong to?
Families USA could be one place. NHELP, the National Health Law Program, really, I think, unifies, organizations like ours all around the country, and finding somebody there who, Jane Perkins is one name that comes to mind. She's a real champion and a real leader, organizing legal aid across the whole country, and to reach out. And, they, I'm sure, have connections in every state, or practically every state. And so them for sure. And there's bar associations, finding online are always places to find where folks are being given opportunities to volunteer and so forth. So those are a couple of thoughts. And there's, like I said, there's new organizations springing up all the time, and new areas of practice that are happening to react to new issues. So it's a field that continues to grow, and I think react in a really positive way across the country to the issues that are out there. So I hope that answers your question a little bit, but I know your point is really important, because my talk was a little bit Massachusetts focused, but yeah, there's organizations like ours, I think, in many different states that people can find without too much difficulty.
Yes. Cool.
Thank you so much. Your work is so important, and we're really grateful to have you here. You mentioned something in passing that I was hoping you could talk about a little bit more, which is how administrative issues and paperwork are real barriers to access to care. And I always find it surprising that Massachusetts still doesn't have a unified application system for its social programs. So I wondered if you think Massachusetts is going to make any headway there. I mean, in other states, I would say it's purposeful rationing. Here, I can't figure out what it is.
I just want to say, to Heidi's question, I want to add, folks can find me, reach out to me. And that was just off the top of my head, where people, I mean, I'm happy to dig into it. I get those questions all the time. What legal aid organization is in Colorado? And so I'm happy to try to help. But, if there's somebody online who's looking for something and can't find it. So I saw the article I think it was in the paper the other day, that there was a law passed that was supposed to create one that was worked on very hard by the policy advocates that I talked about, to get a unified application for public benefits. And I should probably know this, but to my surprise, it's not online. And I just kind of thought that it was, to be honest with you. And so, I mean, that's one of those governmental things. And it kind of goes along with what I said about all this effort goes into passing a law, and you finally convince the policymakers that something is really important. You've rallied everybody, and you go through 3 legislative sessions, 6 years to get something passed, and then it's on the books, and then it's like some of the healthcare rights laws. It's not really reality. So I don't know if there's I have no idea. I hadn't thought about it before just now. If there's a lawsuit saying that needs to be in place, but isn't. But it's obviously really important. Like, it reminds me of what I said about immigrants trying to apply for Medicaid. It's so complicated to upload your documents and to get all sorts of information to the state that they need to determine your eligibility, and I mean, that's the healthcare system for you. It's just, I mean, and public benefits, in a way, it's really complicated, and there's so much. Regulation can be a really good thing in some ways, but it also kind of also can gum up the works in implementation, because state agencies, they're really busy, and advocacy groups are really successful in saying, we do this, do that, do this, do that. And, there are people in agencies, and they have a lot going on, and we want to, in a perfect world, get things programmed and ready to go. And that's in a perfect world. And sometimes that happens, and other times, it doesn't. And that's just, I guess, the real world.
Our other online one first. My name is Mohammed. I'm a doctor in Somaliland. What will be the eligibility of healthcare access of immigrants for legal care in Massachusetts, given the cuts in funding from federal government? I guess, how afraid are you that those are going to change?
That's a really good question. Um, so, as I said, in Massachusetts, we're somewhat lucky in that the state has been pretty generous, I think, providing coverage for many immigrants that the federal dollars can't be used for their coverage. We haven't done it as good as some other states, and there's bills that are trying to make headway on that. So, but even though our state luckily has, invested for a lot of really good reasons, obviously, in health coverage, including for immigrants, if there's major cuts, across the board and restructuring of the Medicaid program, it's going to, affect everybody. I mean, talking, billions of dollars, potentially, being lost, hundreds, I think, of thousands of people losing coverage. I think that's not an overstatement. If the worst case scenario happens in Medicaid, the disastrous Medicaid cuts that are being considered in Congress. But, every day in the paper, you also see some glimmers of hope where there's some people who are going to create a majority against the cuts. And that's encouraging because, and there's organizations nationally who are working so hard in preventing these cuts, and they rely on all of you. If anybody online or anybody here, especially online around the country, call your legislator, please call your legislator. That's one of the biggest things that organizations like ours who aren't, on Capitol Hill, we're telling people to do. Please call your members of Congress and tell them that Medicaid is important to you and that you don't want them to support bills that are going to cut Medicaid. So that's one of the biggest things that people can do, and I definitely want to get that message out. Luckily, here in Massachusetts, we have a delegation that I think is quite solid in
Pretty
that
much on
space.
board,
We
right?
know they're going to support, oppose cuts to Medicaid, thank goodness.
Yeah,
So residents of Massachusetts can call their state legislatures because the budget that's coming up, there's a specific important thing you can encourage them to do, which is to fund the mental health programs that we donate.
is that right? How'd you get that?
Yeah. Thank you, Woody. That's very nice. We do have some funding. We're very fortunate that the state legislature has, and the governor has supported funding for our mental health advocacy program for kids. We're really proud of it, and we are very grateful that we receive funding through the state budget, and we're hoping that that continues.
Well, I assume it's a pretty unique program.
It's a really unique program, and again, the BU School of Public Health has such an important role in the way that the program has become so effective and serves so many people, right? When we were first developing the program, 10 years ago, and the program is really one of the things I did mention is one of the roots of the program are it was meant to help kids get diverted from the juvenile justice system. So we knew and had heard from judges in the juvenile court that there were a lot of kids in the juvenile court system who were there because they were truant or they had run away from home or something like that that got them into the court system. And so they're sitting there in a court lobby about to see a judge, and the only reason why they're there is because they have a mental health need that's not being addressed. And so we created a very small pilot program, and when we wanted to grow it, got some very generous funding from the Tower Foundation in New York. I want to give them a shout out. They funded this big study by the BU School of Public Health to look at the program. And we knew that in order to really make a fair case to the government that they should invest public dollars in this program, we wouldn't expect them just to hand it out for something that we say is a great idea. We wanted to have some evidence that the program has a good impact. And so the researchers at the School of Public Health, Emily Feinberg at first, and now Dr. Elliott, helped us gather all this data and looked into it. And we got these results that we had expected. You're doing this work and you're finding that, oh, we're done with this family. They seem to be doing so much better. So that occurs to you. But having data that researchers have gone through to really show that kids' mental health, through diagnostic tools is getting much better, and the idea was that by keeping kids out of the hospital, because they're pretty much all on Medicaid, and so you're saving all these dollars from kids going into being detained in the juvenile justice system or hospitalization. So any dollars that are going in to support our work are really saving, presumably much more on the other end by keeping kids out of hospitals. That's being paid for by Medicaid, and out of juvenile lockup, which is, $100,000 a year right there,
Great
or more
example.
probably by now. much
Great
more.
work, great example. Good to work with the school public health. We like
Yeah,
that too,
absolutely.
right? And we'll get the dean up here to take us away.
Perfect segue. And so, Matt, thank you. Thanks for the
Welcome.
talk.
Thank you.
Thanks for the work you do every day.
Thank you.
George, thank you for running this. Thanks to the Center for Health Law, Ethics and Human Rights. Thank you to those of you who came out today on this sunny Boston day. Thank you to those of you who are on